And thank you for those of us who are just joining us for today's webinar, Understanding Transportation Barriers for Diverse Individuals with Disabilities and Older Adults. And again, we are joined today by Melissa Gray and Carrie Diamond, who are from the National Aging and Disability Transportation Center. So we are very pleased to have you both with us today. I'm going to hand it over to you for the presentation.
Thank you so much, Carlene, and hopefully everyone can hear me okay. If you can't, you all running tech, please send me a message in the chat. Well, as Carlene mentioned, my name is Melissa Gray. I serve as the Assistant Director of Transportation at the National Aging and Disability Transportation Center, as well as U.S. Aging. As Carlene mentioned, I'm also here today with my colleague, Carrie Diamond, who also serves as the Assistant Director of Transportation and Mobility at Easter Seals and the National Aging and Disability Transportation Center. The acronym for our center is NADTC, so you may hear us using that throughout the presentation, but just wanted to preface our presentation with that. We are definitely excited to share with you today some key findings from our recent national survey on transportation diversity. And we hope that from the presentation today, we can shed some light on understanding the transportation barriers that diverse individuals with disabilities and older adults experience in their communities. And we also hope that you will leave today's presentation with some insights to help you navigate as you work serving diverse populations who have disabilities or populations who may be older adults. Slide 11, please. So I did want to start today's presentation to give you a bit of information about the National Aging and Disability Transportation Center. We are one of 5 technical assistance centers funded by the Federal Transit Administration, and we also receive guidance from the Administration for Community Living. The National Aging and Disability Transportation Center was established in 2015, and we are a partnership between U.S. Aging and Easter Seals. Our mission is to promote the availability of accessible transportation options that serve the needs of older adults, people with disabilities, caregivers, and the communities in which they reside. We have a few major objectives. We do provide person-centered technical assistance and information on a variety of topics, such as accessible transportation, senior transportation, the American Disabilities Act, Section 5310, and other funding sources. We offer training through our webinars, settings like this, online courses. We also provide those, and we also attend conferences to talk about our work. We use a variety of communication channels, our website, Facebook, Twitter, and LinkedIn. And so we invite you, if you haven't already, to please subscribe to our monthly e-newsletter to stay abreast of what's going on, not only with our center, but also in the field of transportation, aging, and disability. And then lastly, we empower communities across the country to implement or improve innovative transportation programs at the local level through our grant program. And that's one of our favorite parts of our work, is that we invest in these communities to be able to provide accessible transportation for the communities that they serve. Slide 12. So I just wanted to give you some information a little bit about our survey administration. We worked very closely as a staff and with our survey researcher, which was VNL, Research and Consulting Incorporated out of Atlanta. We also put together a National Advisory Committee on Transportation Equity and Inclusion, and this included leadership from a variety of organizations that meet the needs of diverse older adults and persons with disabilities. This process was extremely interactive, working with staff and this committee, as well as other stakeholder groups, and then we were finally able to finalize our survey tool. And the survey data was collected between February 23 3rd and April 19th of this year. And so fairly recent, and we recently just released the full survey report, and that can be found on our website at www.nadtc.org. Slide 13. This slide, slide 13, gives you an insider of scope of who our survey population was. The survey encompassed racial, ethnic, and cultural diversity, including tribal elders and people with disabilities, new immigrant groups, those with limited English proficiency, non-English speakers, and LGBTQ plus individuals. Data was collected, the data collection was conducted among diverse population groups of younger adults with disabilities, older adults, and caregivers. The survey defines diverse individuals as those from historically marginalized and underserved communities, and identifies throughout, the survey identifies throughout 5 racial and ethnic groups. And I just wanted to give you, let you know what those are and what was used throughout the survey. African American, Asian American and Pacific Islanders, or AAPI. This refers to Asian or Asian American or Pacific Islander ancestries, Hispanic or Latino, Latina, or Latinx. We also broke it down by Native American. And then finally, an other category, which encompassed Arab, Middle Eastern, multiracial, not listed, or those who preferred not to answer, and whites. And our white respondents were included if they identified as a LGBTQ person or were caregivers for people who came from diverse backgrounds. Slide 14. Just a little bit about our research methods. We heard from 1,206 individuals. 422 of these respondents were interviewed by telephone. From the younger adult with disability category, we heard from 624 individuals. 100 of these surveys were conducted via telephone and 524 online. We heard from 605 diverse caregivers, and all of those responses were received online. Slide 15. So the 2,435 older adults, younger adults with disabilities, and caregivers who responded to the survey came from all 50 states and the District of Columbia. And as I mentioned earlier, included the 5 racial and ethnic groups: African Americans, Asian American and Pacific Islander, Hispanic, Native American, and individuals who identified as LGBTQ plus, which were in the other category. Slide 16. So this slide does depict a map of the United States. It shows the distribution of respondents. So in each of the states, there are numbers. The number is depicted of how many individuals from each state responded to the survey. We are very proud that we heard from individuals from every single state and in Washington, D.C. About 1/3 of respondents were Hispanic. More than 1/4 were African American. 22% were Asian Americans and Pacific Islanders, and 7% were Native Americans. 16% of respondents fall into our other category, and more than 800 respondents, about 33% of them were immigrants, refugees, or foreign-born, and about 300 of these respondents identified as LGBTQ plus. Slide 17. On this slide, you'll see 2 pie charts. The first pie chart depicting our survey respondents who were younger adults with disabilities, broken down by race and ethnicity. And the second pie chart, our survey respondents who were older adults, also broken down by race and ethnicity. This is the way that we have organized or did organize our survey, and all of the information that I will talk about and Carrie will talk about later is going to be more or less organized in this fashion, where we'll talk about younger adults with disabilities by race and ethnicity, as well as older adults by race and ethnicities. The 624 respondents who were younger adults with disabilities, The number one group that responded were Hispanic, followed closely by African Americans at 34%. For older adults, the largest responded group was African Americans, and then that was closely followed by Hispanic and Native American respondents. Slide 18. This slide shows the types of disabilities reported from the respondents who were diverse younger adults with disabilities. The types of disabilities that were recorded in our survey data, 54% said that they had a physical disability, 30% said that they had some sort of vision loss, 18% some sort of hearing loss, 72% of our respondents stated that they use medical equipment or some sort of mobility aid, and then 54% of our younger adults with disability respondents have a caregiver. Slide 19. On this slide, it shows the types of disabilities reported by our respondents who were older adults, diverse older adults. The types of disabilities that they reported, 51% reported having a physical disability, 11% reported some sort of vision loss, 12% reported that they had some hearing loss, 53% use a medical device or some sort of medical aid, and then 18% of our older adult respondents stated that they have a caregiver. Slide 20. This slide just shows that we are about to go into a little bit of our detailed findings. Slide 21. So accessing transportation for younger adults with disabilities and older adults can be challenging, and we know that. But for racially and ethnically diverse members of these population groups, connecting with transportation options pose a unique set of challenges and barriers. The survey did ask diverse younger adults with disabilities and older adults what their biggest barriers were. The next slide will depict these barriers for younger adults with disabilities. Slide 22. This slide shows 5 individual graphs denoting a pie chart. In each of the graphs, in each of the charts, there are 5 bars, which represent our 5 racial and ethnic groups: African American, Asian American and Pacific Islander, Hispanic, Native American, and other. Among the diverse younger adults with disabilities that were surveyed, the biggest barrier they identified were number 1, no friends or family to drive them. Not enough public transportation was 2. 3, wait times. 4, transportation costs. And then finally, concerns about COVID. And as we look further a little bit at the breakdown among the racial and ethnic groups, we see that the biggest barrier for African Americans who were younger adults with disabilities were not enough public transit, no friends or family to drive them, and transportation that is too expensive. Asian American and Pacific Islanders are more concerned about wait times, transportation costs, and COVID. And for Hispanic younger adults with disabilities, the survey found that their biggest barriers were no family or friends to drive them, transportation that is too expensive, and finally, COVID-19. The biggest barriers identified by Native American younger adults with disabilities included not enough public transit, no friends or family to drive them, and wait times, finally. Slide 23, please. Similar to the previous slide, this slide depicts 5 independent charts, and within each of those charts, 5 bar graphs or bars depicting the 5 racial and ethnic categories. And this slide shows the biggest barriers reported by our diverse older adult individuals that were surveyed. They identified that, similar to younger adults with disabilities, no family or friends to drive them, transportation costs, not enough public transit, and concerns about COVID as the top 4 barriers to using transportation in their communities. The 5th barrier that they identified was different from diverse younger adults with disabilities, and that was a lack of community transportation options. The The groups most likely to identify lack of public transit as a barrier are older adults who are Native American or Asian American and Pacific Islanders. Lack of family or friends to drive them where they need to go is a greater concern for Hispanics and Native Americans who are older. And transportation cost is more often identified as a barrier by older adults who are African American or Hispanic. More than half, between 55% and 71%, see COVID as a major barrier. And for the barrier uniquely identified by older adults, which was lack of transportation options in the community, Native Americans and older adults in the other category are most likely to identify this as a top barrier. Slide 24. The transportation or the lack thereof can affect the quality of people's lives in a variety of ways. And our survey found that diverse younger adults with disabilities and older adults of all race and ethnic groups say that not having transportation often or sometimes prevents them from doing the activities they need to do. Slide 25. This slide shows two sets of bar graphs. The first bar graph depicting younger adults with disabilities, and the second chart depicting older adults. Each of the bar graphs have 5 unique bars representing our 5 racial and ethnic categories. This shows the breakdown of older adults and younger adults with disabilities who are impacted by not having regular transportation in their community. Diverse younger adults with disabilities are much more likely to say that they have difficulty getting to where they need or want to go. All Asian American and Pacific Islanders, or AAPI, younger adults with disabilities, and 100% of older adults who are African American or Native American say that not having transportation prevents them from doing the activities that they need or want to do. Slide 26. And on this slide, again, similar to the slide previously, got 2 unique charts, one depicting younger adults with disabilities and the other, the 5 racial categories of older adult respondents. And these depict our population groups as reporting not having regular transportation, preventing them to getting to the places that they need or want to go. More than half of all racial and ethnic groups say that this is an issue. Native Americans are the highest respondent group for both younger adults with disabilities and older adults, with Hispanic and those in the other category in a close second for younger adults with disabilities, and Asian American and Pacific Islanders coming in second for older adults. Slide 27. This slide shows 2 bar charts depicting the 5 racial categories. The first graph showing the breakdown of race and ethnicity for younger adults with disabilities, and the second chart showing the breakdown among our older adult respondents. And this depicts the breakdown of race and ethnicity among these 2 groups who don't regularly have transportation, and because of that, report feelings of isolation. Our survey found that among the diverse older adult respondents, 100% of older adult Native Americans feel isolated by a lack of regular transportation. And this data aligns with what we know specifically about transportation barriers and challenges found in many rural or tribal and frontier areas. And very often these barriers lead to increased social isolation, especially with tribal elders. For diverse younger adults with disabilities, near to or more than half of each racial and ethnic group reported feelings of isolation due to not having regular transportation. Slide 28. This slide has 4 unique bar graphs showing the racial and ethnic breakdown of diverse older adults with disabilities and diverse older adults and younger adults with disabilities who report that not having good transportation options make them feel either dependent on others or frustrated. And the first set of bar charts, there are 2, shows the breakdown of younger adults with disabilities and older adults who felt or reported dependency on others. And then the second half of the screen shows diverse younger adults and with disabilities and older adults who reported feelings of isolation. So there seems to be a trend across the board for all responding groups, all the racial groups, though some differences are worth noting. For example, more than 50% of Hispanic and younger adults with disabilities in the other category are more likely to feel dependent, and more than half of all racial and ethnic groups are frustrated by the lack of transportation options in the community. And for older adults, the sense of dependence seems to be a bigger issue for Asian American and Pacific Islanders and Hispanic older adults. African American younger adults with disabilities and older adults report about the same level of frustration. Slide 29. The survey also showed that diverse older adults and younger adults with disabilities need transportation to get to the same primary destinations, including going to medical and dental appointments, the supermarket or store, the pharmacy, and to visit friends or family. And you'll see on the next slide that the distribution of responses by race and ethnicity were very similar. On slide 30, you'll see for all races and ethnicities in the younger adult with disability category, which is the first set of bars that you see on the screen, that are on the screen, about 70% indicate that medical and dental appointments and supermarkets were their top destinations, with an average of just over 60% indicating that a top destination is to visit family and friends and to go to the pharmacy. For all the races and ethnicities in the older adult category, over 82% indicated medical and dental appointments and the supermarket or store were top destinations, with 71% and 67% choosing visiting family and friends and going to the pharmacy. Those were top destinations. Slide 31. This slide has four unique charts. Each of these charts representing the four top destinations being medical and dental appointments, supermarket or store, visiting friends and family, and the pharmacy. And this shows the breakdown of top destinations among our younger adult with disability respondents. And as you can, and with the numbers, as you can see, there's little variation, or even with the bars, you can see very little variation in each of the destination categories. For a medical appointment, there's an average response about 71%. For supermarket, an average response of about 72%. Visiting family and friends, 62%, and pharmacy as a destination, 62%. Slide 32. And similarly, this slide depicts the top destinations of diverse older adults by race and ethnicity. Four bar charts on the screen that depict each of the four destinations. And for medical appointments for our diverse older adults, there was an average response of about 83%. For a supermarket or store being a top destination, about 82% was the average response rate. Visiting family and friends, 71%, and pharmacy as a destination, 67%. So I know I've shared a lot of information with you all today, and so hopefully you have some time later to divulge into the survey at a later time. But now we'll pass things over to my colleague, Carrie.
Thank you very much, Melissa. Once again, my name is Carrie Diamond, and I'm going to walk through 3 more data sets from the survey, including the different modes of transportation used, how information about these options is found, and finally, what changes these groups would like to see in the transportation options in their communities. Due to the timing of this survey, we had the opportunity to collect information from before and since COVID pandemic. The survey found that the use of all modes of transportation were reduced due to COVID-19, which was to be expected due to the stay-at-home orders and reduction of appointments and outings overall. Notably, the survey shows that ridership on public transportation dropped since COVID, going from 60% to 32% for diverse younger adults with disabilities, and from 38% to 19% for diverse older adults. On slide 34, you'll see the most common ways younger adults with disabilities get around. The top two most used modes since COVID remain walking at 59% and riding with family and friends at 60%. Uses of other modes, including riding with volunteers, ride share, bicycling, and use of specialized transportation services, remained at least 30% since COVID, which was higher than what the results show for diverse older adults who used all modes significantly less since COVID. And a reminder that this survey was completed back in April of 2021, so the last 6 months of changing pandemic conditions could have changed these numbers since then. This is a snapshot from from February to April of this year. So on slide 35, this shows for diverse older adults that walking and riding with family and friends remained high since COVID at 64% and 43% respectively. Surprising to us was the use of bikes and electric bikes as one of the top modes prior to COVID at 48%, which only dropped to 40% since COVID. The remainder of the top 10 transportation methods older adults used since COVID were riding with a volunteer, riding a motorcycle, motorbike, or scooter, ride share, and use of specialized transportation services. All of these modes were chosen by 20% or fewer of respondents. On slide 36, we broke the top modes of transportation down further by racial and ethnic group. With these 4 bar graphs, we get a picture of who is using each of the top 4 transportation options, which include public transportation, riding with family and friends, biking, and walking. More than any other racial or ethnic group, half of Native American younger adults with disabilities and just under half of African American respondents have used public transportation since COVID. The group least likely to use public transportation, at only 13%, was the group including Arab or Middle Eastern, multiracial, of those who did not list their race or ethnicity, and white respondents who identified as LGBTQ+. There was little difference among the ethnic groups for the other top 3 options of riding with family and friends, riding a bike or electric bike, and walking, which all averaged between 40 to 60% of respondents. On slide 37, we note the primary transportation options used for diverse older adults. While there is less overall reported use of public transportation, the use by African American older adults is the highest at 23%, followed by AAPI at 20%, with Native American elders having the least use of public transportation at 11%. This is the opposite of what we saw for Native American younger adults with disabilities, who were the highest users of public transportation among all racial or ethnic groups in that category. The other top transportation options of riding with family and friends, riding bikes, and walking have similar usage across all the racial and ethnic groups, with walking being the highest at over 60% for all groups. Slide 38. While we identified the top 10 modes of transportation used by both diverse younger adults with disabilities and older adults, the survey listed 17 options respondents could choose from, also including car, pools, van, pooling, intercity bus, planes, ferries, and boats as some of the other options. While these were less used by respondents, further analysis of this data may be helpful for some as they determine the primary modes of transportation for their communities. While we highlighted the top 10 options from the survey results in the previous slides, we recognize that what is available in a community can vary widely. Public transit can be provided by large buses in urban areas or a smaller van in rural areas. Transit can operate a fixed route, or it can deviate from a route to pick up individuals from their homes. Public transit systems with fixed routes are required to have an ADA complementary paratransit service that picks people up at their homes within a specific distance from the fixed route service line. These paratransit services have to abide by ADA regulations required of all public transit systems. Some communities have demand response transportation, which may not be affiliated with the actual public transit system, but could be a shuttle for a senior center or other services that will pick up an individual at their door at the time they request. These demand response transportation programs often operate in a larger service area than an ADA paratransit service associated with the transit system. Volunteer driver programs are an important part of the transportation systems, particularly in rural areas and for older adults and people with disabilities who may need additional assistance. While volunteer driver program services didn't show up in the top 10 primary transportation options in this survey, they remain very important to the populations using them. There is significant variation in what transportation services are included in the broad category of specialized transportation. These can include demand responsive services and even volunteer driver program options. While there are private pay options like taxis and transportation network companies like Uber and Lyft in some communities, you will see from some of the data we will present shortly that costs remain a barrier for many of these private services. We captured some data in the survey about diverse younger adults with disabilities and older adults who drive. However, the majority of respondents to the survey indicated that they do not drive. As we've shown in earlier slides, walking and biking were primary methods of mobility by younger adults with disabilities and older adult respondents. This data can help to expand our thinking about mobility options to include such things as safe pathways for pedestrians and bicyclists. Family and friends is another option for transportation that we highlighted earlier. And we also found out through the survey that family and friends play a role in how younger adults with disabilities and older adults learn about transportation options. Slide 39 shows that in the survey, we found that diverse older adults and younger adults with disabilities most often turn to family, friends, and neighbors for information about transportation. On slide 40, we show overall 75% of diverse younger adults with disabilities are very or somewhat familiar with transportation options in their area, with the notable exception of Native American younger adults with disabilities at only 68%. For older adults, AAPI and Hispanic individuals are not as familiar with their transportation options as 67%. On the flip side, at least 1/5 of all younger adults with disabilities in each racial group say they are not too or not at all familiar with their transportation options. This is even higher for older adults, at 1/4 to 1/3 of older adult respondents saying they are not too or not at all familiar with their transportation options. The exception here are those adults identified as the other category, and further breakdown of this data point is needed to better understand this response. On slide 41, this slide shows the responses by racial and ethnic group of younger adults with disabilities and their most frequent sources of information about transportation. You will see that family, friends, and neighbors was the primary source identified by almost half of all respondents in this category. Online searches was the second highest source, followed by learning about options directly from transportation providers as the lowest. Note that only 24% of Native Americans search online compared to over 30% for the other ethnic groups. This could indicate the unavailability of broadband and technology for this group. On slide 42, this is the data for diverse older adults, and a larger percentage of older adults searched online than younger adults with disabilities as indicated in the survey responses. The exception was Native Americans, with the lowest percentage using this method, and a greater amount indicating more reliance on family, friends, and neighbors. Native American older adults were less likely to search online at 26%, which is at least 10 points lower than the other ethnic and racial groups, again indicating broadband and technology could be barriers to this type of information source. On slide 43, we show 3 bar charts, one for younger adults with disabilities, one for caregivers, and one for older adults, broken down by racial and ethnic groups. To help understand the ability to access information online, we asked these 3 groups if they have access to internet services. Given that this survey was primarily taken online, it is not a surprise that most of the survey respondents do have access to the internet. Native American respondents in each category, however, had the lowest reported access to the internet at 89%, rather than the high 90% for the other racial and ethnic groups in these charts. On slide 44, we look at the results of younger adults with disabilities, older adults, and caregivers who use social media. And the survey results show that social media plays a large part in how these groups learn about transportation services. The survey responses to the question, do you use social media such as Facebook, Twitter, Instagram, Snapchat, or LinkedIn, indicates that diverse older adults have the lowest use of social media at between 55 and 70%, depending on the racial or ethnic group, with AAPI and Hispanic younger adults with disabilities with the highest usage at 90%, followed by the groups in the other category, African American, and then Native Americans at 81%, 79%, and 77% respectively. Slide 45. With this information in the survey about how people find information about transportation and their use of social media, we can make the case for the need for both traditional and online information sources about transportation options. Information referral, whether through a 211 or another one-call, one-click center for finding transportation, can provide information for a variety of options of transportation, which may or may not be targeted to a specific population, and can include private transportation services. Agencies serving older adults and people with disabilities often provide or know of transportation services specific to these groups. Mobility management is an approach to managing and delivering coordinated transportation services to customers. It focuses on meeting individual customer needs through a range of transportation options and service providers. Mobility managers can serve as coordinators and can provide one-on-one transportation counseling, or can work within the community overall to improve transportation options. Mobility managers are just one source for one-on-one transportation consultation, which can also include information and referral services such as those found at Aging and Disability Resource Centers or independent living centers. Often working in a mobility management or transportation program can be a travel trainer. Travel training is a travel instruction on how to access and travel safely on the transportation modes in your community. While travel training programs are primarily found in larger transportation systems, there are trainers who work in similar and rural areas to help people navigate multiple transportation programs that may be needed to provide the mobility a person needs for their life activities. In the picture on this screen, you see a travel trainer working with a person with disability as she's teaching her how to ride the bus independently. On slide 46, we describe a winning partnership between Eldercare Locator and DIAL and the National Aging and Disability Transportation Center. The Eldercare Locator is a partnership with the U.S. Administration for Community Living and U.S. Aging, and can help people find community resources and services in your area by calling or by entering a zip code or city and state into their searchable database. The Eldercare Locator can be found at https://eldercare.acl.gov/public/index Eldercare.aspx. Eldercare Locator is not only for transportation inquiries. However, transportation is the #1 service requested. The National Aging and Disability Transportation Center, or NADTC, has several resources on our website co-created with the Eldercare Locator, including the resource Before You Give Up the Keys, Create a Roadmap of Transportation Independence, which is a workbook for traveling without driving, and a screenshot of that is on this slide. And another screenshot of another resource called Transportation Options for Older Adults and People with Disabilities, as 2 examples of resources found on our website. A new hotline established by the Administration on Community Living in partnership with U.S. Aging and a consortium of organizations serving people with disabilities is the Disability Information and Access Line, or DIAL. This service is currently focusing on answering questions and addressing concerns about vaccinations, but it can connect callers to information and services that promote independent living and address fundamental needs such as food, housing, and transportation. As this is a new service, data is not yet available on the volume or nature of calls to DIAL. DIAL is available Monday through Friday from 9 a.m. to 8 p.m. Eastern Time at 888-677-1199 or dial at usaginganddisability.org. On slide 47, we show that among the top changes both diverse older adults and younger adults with disabilities want to see in the future are more free and less expensive rides and better public transportation. We intended for the use of these survey results not only to understand the needs and challenges of diverse older adults and younger adults with disabilities, but also to help identify priorities. On slide 48, there are 4 graphs showing the top transportation changes that diverse younger adults with disabilities would like to see. And those include transportation that will pick me up at my home or offer personal assistance, and more flexible services, including longer and later hours and weekend service. As we mentioned earlier, almost half of each ethnic and racial group identified the need for less expensive or free transportation, indicating that cost of transportation is a factor when choosing transportation options. Notably, younger adults with disabilities had the highest response rate in favor of less expensive or free transportation at 57%, followed by Hispanic, AAPI, and then African Americans. Of the top 10 transportation options, both diverse older adults and younger adults with disabilities want to see in their community. 3 out of 4 of those changes were the same for both groups. On slide 49, we see the changes older adults would like to see. The top 3 choices were the same as younger adults with disabilities, including less expensive or free transportation, better public transportation, more flexible service, meaning longer hours and weekends. The difference in the 2 groups was that younger adults with disabilities chose transportation that will pick me up at my door and offer assistance, and older adults indicated their second choice was that they'd like to see more options that are easy for older adults and people with disabilities to use, more accessible services. For the remainder of the top 10 changes respondents would like to see, about a quarter of older adults and a third of younger adults with disabilities identified each of the following: safe transportation options, transportation that can be arranged without a reservation, more information about services, and safe and comfortable places to wait, like shelters and benches. The racial and ethnic breakdown of each of these options was fairly evenly split. On slide 50, we show our conclusions and next steps. We are excited to have been able to share the results of the NADTC survey with you today. We encourage you to view the full results on our NADTC webpage, nadtc.org/diversity-equity-inclusion-initiative. This survey is the first step in a comprehensive environmental scan NADTC is doing. Since the survey results were initially released, we have been exploring in more detail the transportation needs and concerns identified by the respondents to the survey by breaking down specific geographic areas, income groups, and ethnic groups. In early 2022, we will be hosting a series of focus groups with older adults, younger adults with disabilities, and caregivers from historically marginalized and underserved communities across the U.S. You can help us by identifying communities where focus groups should be held, or you can volunteer to host a focus group in your community. Perhaps you would like to participate in or host a regional meeting. Maybe you have ideas for ways to gather more information, or on what information is missing, or what information you'd like further descriptions of. We want to hear from you. So on slide 51, we have our contact information, and we encourage you to reach out more about our Diversity, Equity, Inclusion Initiative, or for any other resources and materials you may need regarding accessible transportation. Melissa had mentioned it, but you can sign up for our newsletter at www.nadtc.org. You can contact us through email at contact@nadtc.org or by phone at 1-866-983-3222. We are also available on Facebook, Twitter, YouTube, and LinkedIn. Thank you very much for having us today, and we welcome any questions from the audience.
Thanks so much, Carrie and Melissa. That was a lot of information to process. So I'll have to look a little bit more closely at the full survey later. We did have one of a couple of people ask about employment. Was employment included in the survey, or did it come up as a place that was a destination, a top destination? And, you know, how was that, the whole barrier to transportation with regard to employment, was that included at all?
I know it was one of the options, and it for places people need to go. However, it was not identified in one of the top 10.
Interesting.
Right. So that's exactly what I was going to say, Carrie. And so, but we do have the data. And then one thing that I'm sure Carrie mentioned, and maybe I was remiss to mention when we started, was that we are still very much mining through this data, even though we have released a full survey report. We have a host of data that we have full intention of, you know, digging even deeper into. And so that's a wonderful question. And because we have the data on how many respondents did respond as work or employment being a transportation barrier, at least a top transportation barrier for them, we can do a little bit of a further analysis on that data. So thank you for the question.
And that's, let me just add, Carlene, that those are the type of questions that we want to hear. Like Melissa said, there's a lot of data. What is meaningful to you and what you do, and how can we look at the information that we have, say for employment data, for each of these groups. It might be higher in younger adults with disabilities than in older adults, but separating that out. And I certainly wrote that down as something to explore as we're going forward.
Got it. Thank you. So we do have a question here that says, so how are the results similar or different from surveys you've done previously where diverse respondents were underrepresented? You know, are there significant differences, anything that stood out? Or is this something you're going to be looking at more moving forward?
Yeah, absolutely. And so great question, because we have done several previous surveys. We actually conducted a national survey back in 2018, 2019, and that was surveying, you know, caregivers, older adults, and individuals with disabilities, but you know, all not specific to underserved or marginalized communities. There are some, several overlaps, or I would say some similarities. For example, and we didn't touch on this, but in terms of learning or knowing about transportation options or resources in the community, we found that despite race or ethnicity or cultural background, that all respondents have said that their top source to get information about transportation is either a family member or a friend or a neighbor, and that lack of transportation information is a critical barrier in all communities for all populations, despite race or ethnic background. But as we talked about this data today, and just a minute ago, saying that there's a host of data to continue to mine. The purpose for this survey is that when we did that original survey in 2018, 2019, is that we actually asked our researcher at that point to do a supplemental of at least African Americans, Hispanics, and compare it to white respondents. And because the data was just so minuscule, we really didn't feel confident in reporting at that time on what we had learned. So that led us to do this survey, focusing specifically on diverse populations. So anything else to add, Carrie?
No, I think you've covered it, Melissa.
So we had someone ask whether doing this survey during COVID made it more challenging, had any particular impact on the data that you were able to get.
Go ahead, Carrie.
I'll say that because we used many of our partners who have direct connections to consumers, that was a really helpful method to get feedback from individuals. And the fact that it was online and over the phone lent itself well to the COVID environment where people weren't getting out, they weren't going to senior centers, or they weren't going to places as they may have been in the past to do surveys that way. As we had pointed out, certainly it gave us an opportunity to ask people what were you doing before COVID and what are you doing since COVID? And that had some interesting results. We know that travel declined a lot, but like I had said, we did not expect the amount of people bicycling and walking as their primary mode. Mm-hmm. So that was interesting to do it in a time where they had that direct response. COVID was just a few months before, they were traveling differently just a few months before they had filled out the survey, so it was fresh in their minds. It would be interesting now to see how that travel behavior has changed or normalized, so to speak, since things are starting to open up again, that the vaccine is more widely available and adopted. So it was a very interesting time, and it did allow us to get some data related to behaviors and the pandemic.
Thank you. I think we have time for a couple more. We have a question regarding whether or not there was a distinction made in the survey between urban and rural locations, and then were rural locations put into the category of being underserved, or it wasn't kind of subdivided in that way.
No, absolutely. We had an hour, everybody. So as I mentioned, we the data is limitless at this point, and we did actually in our on a webinar that we hosted on November 1st to release the full survey data. We did a deeper dive, is what we called it, to actually break down survey responses by geographic regions and categories, and those regions included urban, suburban, rural, small town, tribal, and frontier. And so we have that data, and we will definitely make that available to you all as well. And so we, in terms of the question about did we include rural as this particular underserved or marginalized community, well, because we parsed that data out it's within the survey data. So I guess to answer that question, sure. Yes, but not specific in terms of looking at more racial or ethnic communities in terms of, underserved or LGBTQ plus as underserved or marginalized communities. But yes, rural was certainly a faction that we did look at.
So this survey, I guess, was for the whole nation. And so is there anything in the works that will look a little bit more closely regionally?
Carrie, you touched on that. Go ahead.
We are going to be doing some regional meetings in 2022. So taking the data that we have from the national survey and seeing how it hit, if it's representative in the communities that we're going to be doing these regional meetings for. And then the focus groups are other ways that we can get some of that more regional and localized information from people on the ground. But as for a nationwide, any other nationwide survey at this point, we're still working through the data and want to do these regional meetings and focus groups to affirm that what we saw from the national data is what people are actually seeing on the ground, to enable us to better, us and them, to better serve these underserved and marginalized communities with transportation services.
And I think that's what we're probably most excited about. I don't know, Carrie, in terms of just being able to, talk to, individuals and folks that are in the field, like those on the call today, just to know what's, at the grassroots level and maybe even at a higher level, does that data reflect? And so I know Carrie mentioned our convenings that we had in September and also in November, where at least, we were able to, get the feedback and insight from those individuals to see if what we've shared resonates with what you're seeing in your community. But we're definitely looking forward to doing that at a higher level next year.
That's great. So I think the message we're getting here is you've got more to do on it, and people can go ahead themselves, if they have questions about it, and take a look at the report and see if they can find that information. So that's excellent. So for those of you who paid for a certificate of participation, today's, excuse me, the code to get your certificate is RIDE. Again, the code for the certificate of participation is RIDE. If you paid for that certificate, check the reminder email you received about this session for instructions, and you must email the code above to adatraining@transcend.org by 5 p.m. Eastern Time, November 23rd, 2021, which is this coming Monday. And again, the code is RIDE. I want to thank everybody again for coming today. And our next webinar is going to be What's in It for Me? Takeaways from ADA Title II research in the Mid-Atlantic region. And remember, Title II covers state and local government programs and services. So if you are interested to find out a little bit more about what we got from ADA coordinators, etc., you can join us on December 14th from 2 to 3:30. And again, thank you so much, Carrie and Melissa, for presenting today. Thanks again, everybody, for joining us here at the ADA Center. I hope you have a great day.